you so that when you meet a person, right? Because peer support is oftentimes it can be one-to-one, but it's also a group experience as well. That there is power in the witnessing of the wholeness of the other person, their healing and their challenges, right? And we're working those mirror neurons, right? Where if we're witnessing someone go through it, we imagine the what if, the as if for ourselves. We feel that empathy closer to that person. And we can gain and give in community in peer support. So when I think of not, there's no end game. You're always on a journey of authentic self and accepting of people where they're at, and sort of striving to be curious. That to me is some of the resilience that is part and parcel of peer support work. So good to see you back, Kat.
Thank you so much, Lisa. I am so sorry for dropping off technical difficulties with being virtual. I want to talk a little bit about the need to prioritize our mental health, particularly for diverse communities. We've been seeing definitely a growing number of prisons who are doing that. And I think it's very important. But I often wonder if that prioritization of our mental health can be difficult for prisons within particular communities. Kelechi, do you want to speak to that?
Sure, absolutely. And it's Kelechi. I just wanted
Kelechi, I am so sorry. Please forgive me.
Oh, absolutely. We are all learning here. So, I mean, I think as we start to see folks prioritize their mental health and then some experience praise, some experience backlash, depending on who they are. Like, I feel like Michael Phelps got a different response than Simone Biles, if you know what I mean. And I just want to acknowledge that, dating back to slavery, there was this perception that Black people felt less pain than white folks. And it still persists today in the medical treatment. And so, in fact, and this isn't just Black folks, but enslaved people were described by psychiatrists as being immune to mental illness. So literally there was a physician named John Galt that said, oh, enslaved folks, because they don't have property, they don't have commerce, vote or hold public office, they can't have mental health issues. And so there was this language about an immunity hypothesis and thick skin. And I think unfortunately for the Black community, though I don't know that a lot of the Black community knows this became adopted as a belief. Oh, we've got thick skin. Oh, we're good. We survived race. We're surviving racism, I should say. But we survived slavery. We got this. We're resilient. And almost like that language resilience gets flipped in this negative way that, oh, you must never struggle because your ancestors, got us here. And I just want to take a step back, not to shame our ancestors. They did the best that they could to get us where we are, but I believe they have bigger dreams for us. They're not trying to have us struggle for the rest of our lives. They want us to be healthy and wealthy and take care of ourselves. So just because my grandma had to do certain things and assimilate or be really careful or, make sure her hair was straightened or do things so she could actually survive and thrive, I don't think she wants that for me. And I think that's part of it is beliefs and trauma that we've held, this intergenerational trauma that we've continued to hold on. And it's up to us today to stop and say, is this working? Okay, this isn't working. Why am I grinding like this? Why am I exhausted? And if the pandemic taught us nothing, it taught us that our mental health is a priority. So it really is up to us. And even if we have these cultural beliefs that maybe never actually came from our culture, but we adopted, it's up to us to actually say, is this still working for us? Because I don't really believe it is.
Yeah. Wow. I agree with you so much when you speak about the resiliency, because I feel like sometimes it's almost like we're expected to be resilient. But that expectation to be resilient, I think, doesn't allow for us to be, just honest about the fact that we're not okay and we're not doing okay. And I think it's also a lot harder for diverse groups. It's a lot harder for BIPOC, LGBTQ folks, disabled folks, because I feel like, you know, that awareness is not there for their specific challenges. Faye, I wonder, when we don't talk about these things, when we don't have these conversations in depth, you know, what kind of impact does that have on the population that that we know are being most historically excluded? What effect does that bring?
Yeah, you know, when we talk about kind of combating this notion of, you know, having to lean into resilience and not acknowledge pain, you know, it's really kind of, you know, the antithesis of vulnerability, right? People need to, you know, be able to shed their pain. They need to be able to talk about when they're not, you know, feeling well, when they can't continue. And I think when we stifle these conversations and when we don't encourage them, it further adds to that lack of emotional safety that I think a lot of people of color need in order to feel comfortable talking about these feelings. I mean, you know, we notice it even just from a publishing standpoint, you know, when we are conscious about making sure that there's diversity reflected in a conversation about bipolar disorder or about schizophrenia, we immediately get responses from the community that's like, I was able to print this out, this person looked like me, you know, now I can have a conversation with my family, now I have a roadmap for where I can go. So it's just increasingly important to continue to have these conversations and to encourage them.
Yeah, I resonate with that so much. And I tell people when I was struggling with my own diagnosis, I didn't know anyone to talk to about it that had my color, you know, and I felt lost because who do I really turn to? Lisa, I think Lisa just so Alicia, I'll direct this question to you. I'm seeing a question in the chat that says, you know, how can peers, especially BIPOC peers, be a part of changing things in the mental health system? How does that happen? So the person is saying, like, for example, they found that some of the organizations don't really want to hear about anti-Blackness and the direct negative impact it has on mental health. So how do BIPOC peers now have their voices heard? And I will also add to this question, and not be traumatized and triggered while they raise their voice.
That is a really brilliant question, and I know Lisa Sun will hop in and talk about this. I think for me, when I think about, there's part of me that assumes good intentions, and then at some point we have to just actually assume actual intentions, right? So even sometimes we talk about diversity and equity because it feels more comfortable to talk about that than to actually get into like anti-racism and challenging white supremacy, because those things can feel scary, but really when we look at these kind of frameworks and like break them down, we can see what's not working for our communities and what hasn't ever worked. So if your community or your organization isn't comfortable talking about anti-Blackness or doesn't want to have that conversation, I think it maybe takes some steps back and say, like, what are your values? If we are here to help people's mental health, and racism and white supremacy impacts people's mental health, and let's be clear, white supremacy impacts white people's mental health too. So it's not just a, you know, one and done. But I think Yolo Achilles says it really well. We live in a racist, sexist, transphobic society with lots of isms. Sometimes when we try to talk about racism in our communities, people get super defensive, like, but I'm a good person, I have good intentions. So he encourages us not to ask the question, is this racist? But how is racism showing up in the behavior? How is it showing up in that policy? Because then you're not going to get so defensive, because we've been programmed to believe these things. I have internalized stuff I have to work on and undo. So I think part of it is, how do we look at it in our policies? So I'll give you an example. There's some policies out in California where some people use culturally responsive programming, and they're like, oh, let's do innovation programs. These programs only last 1 to 2 years, so they'll lose funding, but everyone's so excited about them and the funding's not sustainable. If we were to look at this in an anti-racist lens, we would say, oh my gosh, these vulnerable communities, they need sustainable funding. We cannot use this funding source that dries up in 2 years, or give everyone who's in a cultural community a pilot program. What happens to pilot programs? They don't get funded, they end. And so that's not about being defensive, it's about like what's going to work well for our entire community to help our mental health right there, right? So it's not about you're a bad person, you're a good person. It's like, hey, we've been programmed, the system itself is racist. How do we actually as peers interrupt this? Because our grassroots is an advocacy, right? That is what we're here for. So if we dull that down, we have a big problem. So I just wanted to add that there.
I'm back. Thank you, Ken. Okay. My doggies are in another room and they were howling, and I couldn't possibly allow that on the screen. So I hushed them, and I'm back again. But I think about sort of smaller examples of, Kat, you had mentioned, this idea of being able to speak to someone and be vulnerable, right? Like, for example, in the workplace. And I'll give you an example of a microaggression a person of color might often experience. Let's say you're a direct worker and you're just trying to have a nice chat with a manager, right? Trying to be personable, get to know who they are, right? Tell a little bit about who you are and how you feel about them, and just enjoy what you think is a nice conversation, right? Let's assume that the manager identifies as white, non-person of color. And you walk away from the conversation thinking, great, wonderful conversation. But then when you go to have your own supervision with your actual manager, they bring up with you, they go, you know what, I was talking with Bob, and he just wanted to make sure that everything was okay with you, because it said that you had a little bit of a conversation and you revealed some things, and I just want to make sure your mental health is okay. To me, that is a microaggression, because it kind of slaps you in the face. You go, excuse me? Why are you asking me if my mental health is okay? Right? And I think that oftentimes what I consider keeping it 100, which is being your authentic self, is seen as unprofessional. And if you are a person of color and you're unprofessional, it can often be attributed to mental health challenges. You're unstable, you're unwell, are you okay? And that is a tiny way that, even though that other manager might actually be well-meaning, the way that they perceived the information, processed it, and then made a decision to walk over to another manager and go, you know what, I think something's going on with Susan. I can't really put my finger on it, but I just maybe you just need to check on her. And that I can't put my finger on it is often unacknowledged racism, right? It's just, there's some feeling I have about this person. And those feelings I have about a person are based in societal messages that we've absorbed because we're swimming in the same water, right? So when I think about that, then that person of color goes, ow, because microaggressions are accumulative small bites that bother you over time. Right? They're not often something that's like a direct hit. And so you learn, well, perhaps I won't tell you how I really am if I'm not feeling well, because then it becomes a whole other issue, right? Somehow it gets tied to your performance and your value and your productivity, capitalism. So, I think about those things make it difficult for us within our systems to create safe spaces for BIPOC, LGBTQI folks, right? And we need to try to model the behavior that we're looking for, right? So, like, for example, like in that example, you'd rather just have them talk to the person. If you were really concerned about my mental health, you would have come to me, not to my supervisor, because then it becomes a performance problem. And then you're at risk of losing your job. And then you're never going to want to say anything ever again, because your livelihood is on the line.
Yeah. Wow. As you were talking, I think about the fact that for so many BIPOC LGBTQ folks, there is a smalling, we say smalling in Trinidad and Tobago, which is like you minute yourself to become smaller to fit in the box to fit in. So you change your top. You don't talk about your sexual activities. You don't talk about who you're dating. You don't talk about your disabilities. You don't talk about your mental health challenges. And you just keep making yourself smaller to fit in this space. And that process in itself of having to dim your shine to fit in, to be professional, has such and I think about Simone Biles in this. That does something to your mental health, say in this, we recognize that there's a difference between equity and equality, right? And I think so many times, I feel like there's a lot of equality conversations happening, but not real equitable solutions happening. What do you feel about that?
Yeah, I mean, I agree 1,000%. I just wanted to just jump in on that point, though, that you were making about, how folks do change themselves to fit into different environments. We just wrote a great article on code switching and the mental health impacts on code switching. I think for a long time, communities of color have just celebrated our ability to be able to assimilate and go into different situations and speak differently and move differently. And I don't think a lot of thought has been given to what toll does this take that you feel like you have to shift yourself, and you can't show up in places authentically. So I just think that, that's such a worthwhile conversation for sure. But yeah, in terms of equality and equity, I think, everybody is for equality, right? Everybody wants everyone to have the same resources and, the same opportunities. But I think equity is when you get actionable and when you get in the nitty gritty. And that's where we experience some push and pull sometimes, because that's when you have to sit down and think, how do I make this so that everyone has the same resources? And sometimes that means taking from some and giving to another, so I think, when we talk about that distinction, equity is the action for sure.
Yeah. Lisa, how do you feel about equity, equality, and what's happening in the mental health spaces?
Ooh, let's talk about this, son. So, okay, let's think about the fact that a lot of BIPOC LGBTQI people work night shift, right? And you might say, well, they make more than day shift does. But just because they have choices doesn't mean they have good choices. So a lot of the folks that I talk to say, you know what, I take it because I can get it and I need it and it makes me a little bit more. But that would be like you being like, oh, well, it's equal. They get paid more, so it's fine. But that's not necessarily equitable, because there's still like a vast deficit as to someone who's putting their body through overnight shift work, right? And oftentimes those people that are doing overnight shift work are awake during the day, doing and having to do other things, care for a loved one, tend to an elder, help some of the other children, trying to make a little extra dime on the side, when they rightly, it would be better for their health to be sleeping, but they're not, either by choice or by circumstance. And so to me, equity would be giving them more than just like the fact that there is a pay differential, right? Moving beyond just like reasonable accommodations, because sometimes it is the relinquishment of your privilege, right, in order for things to be equitable. For example, the privilege that you are working during the day means that sometimes y'all need to sacrifice doing something in the wee hours of the morning when they're working. Even though it's a pain for you to switch your schedule up one day out of the month, it would be more equitable to provide a service to those people at the time that is good for their body clocks, when you have the privilege of being able to work during the day, right? So that's what I think about equity and equality, right? It's like you might have one nice little community with lots of tall buildings and another little community with itty bitty buildings, and everything underneath that is community resources. Equal would be if they both got the same amount of pipeline, right? But what we really want is equity, which would mean you still get a pipeline, nice little buildings over here, but these ones get 4 or 5 extra ones in different areas of the community so that they can be built up, so that you can eradicate the wall and let there be liberation, right? So it's acknowledging that there are legitimate obstacles in the way. We all don't start at the same part of the race. Some of us have to run longer, even on the same track, right? So it's just thinking about ways that we can challenge the status quo of like, oh, I don't want to give up these privileges. And go, if I really want to be an advocate and an ally, I'm gonna have to let some of my privileges go. Because sometimes equality feels unfair to the people who are used to having it all.
Yeah.
Because they feel the loss. And these people only feel the barely getting up to the satiation point. So it's like, that's a little bit of what I think about equity on a working level.
Yeah, I love that. And it makes me think about, I feel like sometimes even the forethought that goes into inclusion. So we're gonna hire more persons for this specific population, but we didn't think about how has this, what is the reason this specific population has been left out, and how can we ensure that they have access to all the knowledge, they have access to all the resources. Like, what are the things that they have not been exposed to that we can now make sure that really brings about, equity. I would love to throw it to Kelechi. I'm really trying with my tongue, so please forgive me. Yeah, can you tell us more about that forethought that goes into bringing an equitable peer support piece?
Absolutely. And don't fear, just lean into it. We'll be okay. So I think sometimes people have the good intentions of hiring people. They're like, okay, we'll get a more diverse workforce and that will fix this challenge. But if you haven't actually made a space for BIPOC folks, people like who have disabilities, LGBTQ plus folks to thrive, then what happens is the code switching. So if I'm like, oh goodness, this is not safe for me, I'm assimilate, I'm gonna do what I need to do, I'm gonna have resting nice face. That's what I say, because I've resting nice face, which has allowed me to not look like an angry Black woman. I have practiced it, right? That's something I'm unlearning. But I guess what I'm saying is that if these spaces aren't actually safe for people, we'll just continue the same things we've already done. And so one thing we can think about is, what does your leadership look like? Because leadership, what does your board look like? Is your board diverse? Is it intentional about intersectionality? What is the demographic makeup? Is it reflective of the communities that you serve? And if you're an organization that says, man, we can never find BIPOC people to hire. And I'm like, that's not true. Maybe it's a curiosity of like, why don't people want to work for you? Have you done exit interviews with people who have left who are people of color and actually explicitly said, how has racism showed up? Or why did you really leave? And maybe like really looked at that data and heard what the real stories are, because diversity without inclusion is tokenism. And I have been tokenized a lot. I think a lot of people, BIPOC folks, have had that experience of, cool, you're going to be that person who speaks on behalf of everyone, right? None of our communities are a monolith. We have so many different identities, just like not all white people are the same. We're not the same either. So you actually need your workforce to be as diverse as the communities that we're serving, which is very, very diverse. So I think that's something that we should definitely consider and lean into. And not have, and I think another thing is not have these one-off strategic, like, let's have a focus group and then never hear from anyone again, right? I've also had that happen too. Like, we're gonna get woke for this week, and then what happens? It's an ongoing, it's like allyship. Allyship is not a destination, it's a verb. It's ongoing. You don't stop. It's constant work. So I'd just like to uplift that.
Yeah. I want to add something in here. And Faye, I'm going to direct this to you, because we're saying all this, and I also have the acknowledgement that equity is very uncomfortable for a lot of folks. Like, we don't know sometimes how to even have these discussions, right? How do we really go about things? What's your experience with, I mean, I hope no one says that, like, what's your experience with racism, or what's your experience with discrimination, and asking and engaging in discussions. I don't think that we should ask in that way, but I just want to recognize that it is an uncomfortable process. Faye, could you speak to, if there is someone out there thinking, I don't know how to begin this, right? I don't know how to begin having these conversations. I see my board, I see, I see our leadership, I see there's something going on there, but I don't understand what's the problem, and I don't know how to begin addressing if I don't understand the problem. What do they do? Like, how do we even begin this?
So tough, because it's so dependent, I mean, on how you feel safe showing up in work. Where are you? Are you entry level? Are you in the C-suite? Like, I think a lot of those things inform kind of your agency and how you feel comfortable arriving and having those sort of conversations. But as I mentor a lot of folks, and a lot of times what I hone in on is, when you were interviewing for a job, you were interviewing them just as much as they are interviewing you. So before you even get into a space, you need to look at the board. You need to look at whether or not there is action behind statements that companies make, to kind of assess whether or not this is a place that you can grow, and this is a place that you can feel comfort. And speaking to mentorship, which is, I guess, similar in a career world, sort of to peer support in some ways. You want to have conversations with people that you trust for gut checks, like, was this a microaggression? A lot of times you do kind of talk yourself out of the things that you're feeling or the things that you're seeing. Am I actually feeling this? How do I know that this is accurate? Having those people that you trust to do those gut checks is so important, to starting those conversations. And I think also, building that consensus and that sense of community. When you start to trust people, you start to have these conversations, and you think, okay, now we have a group behind us, and let's think of a way that we can, that people love to say this, and I'm sure some folks are probably tired of hearing it, but calling people in instead of calling them out, but thinking of actionable solutions. If you feel like you're working in a space where people are receptive to these sort of conversations, come to folks with solutions. People love to hear solutions, and they also love to hear how it impacts their bottom line. If you could think of a way to tie it back to revenue and money, in ways that a change in policy can be more beneficial to the bottom line of a company, I think that's when you can impact meaningful change, but I say all that with the caveat, sometimes you just got to go, sometimes places are just not suited for you.
Yeah. I'm gonna throw a question in the chat out to any one of you, because I find it's interesting. And the person says, what do you think about addressing internalized oppression among underrepresented groups? Because this can get in the way of deepening the implementation of equitable practices amid creating a culture of equity. I will leave the floor open to any one of you ladies. Lisa, I feel like you want to. Oh, okay. Kalisi, go ahead.
I'm sitting here chewing on it, because sometimes I think that people that are in leadership positions need to display courage. And what do I mean by that? Courage to hold space for uncomfortable conversations. Because you're not going to be actually unsafe, but you're probably going to be really uncomfortable. right? And so when we think about folks that have internalized oppression, I think it's the onus would then be on the leader to recognize and be trauma informed and go, there might be other things at play that's impacting this person's behavior, their emotions, how they're showing up. And to say openly and often, this is a safe place to talk about these things. Like, I'm not going to blow out. I'm not going to say it's because you're unwell, right? I'm going to accept you unconditionally, at that unconditional positive regard, and model for them that you can be safe here with me, and to also verbalize and validate the oppressions that they are experiencing, right? And go, I also see this. I see these things that are impacting you in your life. So in that way, trying to really model in the structure itself, in the relationship between the people, that you have genuine affection for their whole self, not just for their ability to be productive. Did you meet your deliverable? But that we are a workplace and a workplace culture that honors and wants all of you, even when you're well and when you're not well, because we accept that humans are always on a journey and a process, and you're not always going to be at the top of your game. Your supervisor's not always going to be at the top of their game either. So those are some of the things that I think about how you can try to work with people that have internalized oppression and say, you know what, this is what I'm seeing. Put it on a platter and see if they go, wow, that is what's happening. Wow, thank you. Someone finally saw me. Yeah.
I just want to add that, the grace that we give other folks for like learning about racism and unlearning, we have so much to unlearn. And I think there's almost like, I've been in different affinity groups where I talk to other people and I've learned from other Black folks, and I've held spaces where there were, multiple folks. And I think that's the gift of having diversity, is because if you have only one person and they've internalized a lot, and I've internalized a lot, right? Like I'm not coming here like, no, I'm perfect. No, I definitely internalized a lot, and I didn't use my voice because I didn't feel safe. But then when I was around other people, I was like, oh wait, what have I kept on? What do I need to learn about my history, right? We don't know actually our history. We don't know what's ours and what was programmed. And I think there's like a bit of work that we have to do to deprogram ourselves. But if you're seeing someone else in a space who has internalized a lot and they're in a place of leadership, how do we invite those conversations? How do we invite more people to have different perspective? Because that's what happens when you make one person a representation of everyone. We get into some trouble, especially if that person has succeeded by assimilating, right? And that's what happens. We get moved up if we're perfect, if we do the right thing. We don't make noise. Everything's comfortable. But a lot of people made a lot of promises in 2020 about social justice and equity. So if you're in one of those places that said, you know what, we're seeing racism in the Black community, we're seeing racialized violence in the API community, we are taking a stance. If anyone made a stance, right, can we then now say like, hey, remember that stance you made in June of 2020? What's happening with that? What are the actionable goals that you have? How are you actually changing the pipeline? How are we continuing the conversation? Because I got so many emails from so many people, and it's time to check in, and it's always time to check in, right? So that's what equity is. It's action. What is that equity? So I just want to lift that up.
Yeah, thank you for that. And I think for me, in my perspective, the grace that I would want people to have for me, I want to try to give it to others as well. So like, I recognize the fact that, right, like for some people, code switching has become easy. I mean, I say that very hesitantly. And you're right, they have been able to assimilate and get ahead. And, someone told me, you have to learn to play the game. And I'm like, I'm not good at games. So like, and but some people were able to do it. And I think for me, it's more about getting mad at the system than getting mad at the person. Because my disadvantage is that I didn't learn how to play the game, nor do I want to learn, but I can't be mad at them that they did what they had to do to get by and to thrive. You cannot be angry at that, in my opinion. So I really just want to offer grace to persons like that, you know. I want to go a bit more, we've been talking just more general mental health and equity, but I want to go a bit more into peer support model and how this peer support model has room, in my opinion, to really promote equity. Lisa, I don't know what your views on that is, or how do you see peer support and equity intersecting?
Well, let's see. I can think of a personal example of what I wish had happened, right? Is, for example, I saw my aunt caring for my grandmother in the end of her life for years. And that is like a 24/7 job. The amount of effort that she put in to learn medical language, medicines, keeping track of doctors, trying to figure out what was going on, learning, all the things that was around the end of life, the end stage of caring for your elderly, caring for your loved one. Innumerable hours, incredible emotional toll, but no real recognition from anyone of how much work that was. Right? And when we think of like a community health worker, it's usually we're only asking them to show up with one or two sections of their identity in the work that they're doing, right? Like maybe I just need age and sex. Maybe I need orientation and, just you see what I'm saying? They're not really asking for you as your whole person. But I think that peer support's definition of what that is I want all of you to show up, all of your intersections, all of your identities in this relationship, and to be valued for that, like for you and for the accomplishments that you've made in doing these things, right? Whether it's like taking care of a loved one or working in a community health center or wherever it is. There's a plethora of people that are going to age, and there's not enough workers to take care of those people. Like when you think about in 20 to 30 years, the population of folks who are going to need care are going to be much, much higher than nurses, like certified folks. So to rise up and have peer support seen as a valid, credible contribution to the public health system allows for an entire different leg of a career to be created, where people and their work and their passion and their self-lived experience plus their education will give them a viable future. So they can still be in the community in the ways that they want and have enough to stay there and care for those communities instead of having to go someplace else to make money because their community is too poor. So like that, those are some of the things I think of, like generationally, what's going to happen later, validating an entire workforce because it is valuable, it is credible. There are ethics and boundaries that people do, right? We're not inherently more breakable or vulnerable. And so just to uplift that so that we can really think about legitimizing the concept of peer support and reducing the stigma so that you can be your whole self and then you can feel perhaps a sense of relief, a sense of kinship on your own journey, how you choose to do it without judgment, without exclusion.
Yeah. Before before I lose track, I just want to remind everyone, if you have any questions for the panelists, feel free to put it in the chat. We just have about 10 more minutes, and I just want to make sure in case you have those burning questions that we address them. Kelechi, Lisa spoke about, the value that peer support has and really like building, equitable space, as she said, as bringing your whole self to the table, which I think is really amazing. But I think back to the history of peer support, and I think back to, has peer support been shaped in an equitable framework, or is there space to grow in peer support when it comes to that?
Yeah, it's a really good question. And sometimes it's a hard question. So, peer support came out of the consumer movement, the ex-patient survivor movement. And this is a movement of folks who were dealing with a mental health system that abused them, used chemical restraints, involuntarily locked them up, overdiagnosed them. And I have to say, the system still exists like that. We can code it differently, but the mental health system still has a lot of challenges. But the idea of peer support was that all these patients, ex-patients, were coming out, and this is at this time of the civil rights movement, and they're seeing like, oh my gosh, wow, look at all of these, these individuals fighting for their rights. They said, we were inspired by this movement, but they didn't integrate into the movement. So I think, and that's what folks were doing at the time. And this is not to shame our origin story, but if we go even further back to our whole origin story, is that every community has storytelling as part of their culture, right? As sharing part of themselves. Talking circles and indigenous cultures. I mean, there's so much about sharing of yourself that we forget about. And this is the original impetus before the ex-patient movement, before peer support. So if we go back to our roots, our collective roots, it is in sharing of our whole selves. And so how do we actually bring it back and integrate it into, okay, maybe I don't have the same exact experience of you, because it would be great to have someone who has my gender identity and my identity, my racial identity, and all of those important things. That would be awesome. And I'm always going to fight for that. But if you don't, how can I say, I don't know your experience, but I hear you and I'm with you. And I'm not going to say it's not real, because that's a great thing about peer support. No one ever invalidated my mental health experience, because they were like, oh yeah, girl, me too. This is what they told me. Here's what hope and recovery looks like for me. Because we're not clinical. We might be on teams, but the idea about peer support is that we're coming with that lived experience of where we've been. And that experience and expertise is just as important as okay, I'm going to diagnose someone, which is a whole nother conversation, because the DSM has been used in some horrible ways to overdiagnose people, or even homosexuality was in the DSM. So again, uplifting an anti-racist framework that is also inclusive when we look back at things we've always done. But ideally is that, how can we move forward with people being more comfortable having the conversation and owning where they're at and being like, wow, I messed up. Do you know how many times I mess up? All the time, right? I am not perfect. I am practicing allyship in different communities, and I'm like, oh no, I messed this pronoun up. Does that mean I'm going to just never talk about it again and exit the conversation? No. It's like, okay, this is important. Let me learn, let me read, and let me not make that labor your labor. You have enough labor with your identity. Let me do my own research and see what that needs to be, and then come correct. And I think if we can call people in, as Faye was saying earlier, right, instead of canceling everyone, then we could be in a really better place and oh, okay, we're going to just learn and mess up together, but strive for better mental health. Because isn't that what we want? I think that's what we all want for everyone. So, I mean, I'll leave that there.
Yeah, no, I love that. And it carries me over to my point. What do we want? So I'm gonna throw this off to all of you. Faye, I'll start with you. In this conversation about equity within our mental health and our peer support system, what is that one thing that you would want to see happen?
Yeah, I mean, I'm glad, Kelechi, you quoted YOLO earlier, because I'm such a fan of what YOLO's doing with BEAM and Psych Central and Healthline has recently announced a partnership with Beam, where we're going to just be amplifying their work and helping to support their initiatives. And I say that to say, for me, it just seems so important to bring validity to these different modes of healing. You know, as Coach was talking about, these things have been around, you know, for generations, you know, and somewhere along the line, we lost the ability to say, hey, this is a part of my healing circle. This is a part of my healing journey, you know, is that I can talk to people in my community, at church, you know, I can talk to my hairstylist, you know, these sort of things. So, you know, what I want, you know, and of course, you know, Psych Central, we aim to really, you know, talk about the traditional modes of healing and Western medicine and those things, but at the same time, I want it to be on equal playing field where we talk about these other modalities of healing so that people feel whole, you know, and not invalidated, you know, in their path to healing.
I love that. I definitely agree with you on making it normalized. You know, I personally still feel shame about saying that I talk about my mental health with my new sex, and that's a regular conversation that we have. And I'm like, but she's a part of my tribe. She's a fundamental part of my tribe. So I think it's good to have that conversation. Lisa, what is your ideal one?
Oh, it's so hard. You've given us such a hard question, Kat.
I'm sorry.
One thing? I think that maybe one thing that I would like to have in like equitable peer support is removing like this idea of what is the professional interpersonal relationship. I think that if we're gonna invite people to be their whole selves in the work, then we need to be and bring our whole selves to the work. And in that relationship, to have affection for one another. Because, I mean, sometimes, like if you go to the military, they would clearly, oftentimes, my whole family is military, all of them. They always said that you had to have affection for your comrades because you relied on each other's lives and you really got to know each other very well. It was a brotherhood, a sisterhood. And I do think that affection and that heart of service is really important in a peer support relationship, because so oftentimes we can be most easily wounded by our family, our friends, and our colleagues. So the onus on us is, if we're in systems, is to try to embrace and shake and create systems that will love your whole self, and be willing to be with each other. So that, I think, is what I would like to see for more equitable, like in action, like that heart to heart. You're still professional, right? But you don't have to be like pinstripes and pearls professional. You know what I mean? Like there are ways that you can essentially shoot the shit with each other and still like be professional and get things done, and feel comfortable to be you, like you said, without turning down your shine face. Right?
Yeah, I love that. Kalashi, last words from you.
Last words, so quick. I think if you have seen things that you want, stop waiting for someone else to build it and build it yourself. Because you're dreaming. I'm seeing so much big dreams in this chat of like what you want and what you want leadership to do. You are already leaders. Why don't you build what you want to see? Because that's how Beam started. It's what anyone else who started something. That's how peer support started. People didn't see what they wanted, so they built it themselves. So don't just rely on other people to give it to you, and still push for the system to do right. And let's radically reimagine, but let's build something different. Because I think you actually already have the answers. So I think it's more of like, how do you build? Thank you.
Thank you so much. I want to thank all of you for being here. Thank you to our attendees for being here. Thank you to our panelists. I am really glad that we had this discussion today. And I also want to say that, yes, you are going to get the recording. So within 5 business days, the link to the recording will be emailed to you, as well as the link on how you can get a certificate of attendance for attending today. So thank you very much, and look forward for next month, where we will have our another webinar series. Take care.